companion. Somebody willing to wake up, give kisses, pee on a tree, sleep all day, wake up again, give more kisses, then stay up until midnight basking in the glow of a television set. So God made a dog.
And now, it's time for the Down with Dogs podcast, a dog cast dedicated to keeping your furry baby fit, healthy, and happy. Here's your host, Courtney, and her boy, Jackson.
Welcome to the Down with Dogs podcast. I'm so excited. Today, my special guest is actually a friend of mine. We've been friends for probably 20 years. Erica McElway from Change Your Range in Holyoke, Mass. And she has spent pretty much her entire career rehabbing animals. And I'm talking any animal. She rehabbed my horse. She rehabbed my Great Dane, who lived to be almost 12. And without Erica, my dog, my Great Dane would have been gone at age 9. She will be talking today about myotherapy, massage, hydrotherapy, and, of course, rehab for your fur baby. Welcome, Erica, to the show.
Thank you so much, Courtney. I'm excited to be here.
I tell you what, you have saved me throughout the years. I mean, I remember you basically swimming with my horse in an indoor pool. And then I remember with my Great Dane who couldn't walk, he was getting older. Was it hydrotherapy you did with him?
We did the underwater treadmill mostly with him. And that really is what kind of helped rebuild those muscles that were so hard to get ahead of that arthritis.
I literally got 3 more years with my fur baby because of this woman I'm sitting with right now. So welcome to the Down with Dogs studio. So I don't know, maybe we should just jump right in and talk about some of the things you guys do at Change Your Range because you are saving animals' lives. Let's start with myotherapy. What is myotherapy?
So myotherapy is actually muscle therapy. Myo pertains to muscle, and the therapy aspect of this is that it's muscle therapy.
Okay.
So my background and my training is trigger point myotherapy.
So what problems do dogs have that would need this?
So all things that can be created into what makes a trigger point can actually, as in myotherapy, is that it's an insult to a muscle.
Okay.
So I mean, even dogs that are just born being, held in the womb, being what they call crowded inside the womb because there's multiple births in most of the dogs being their birthing process, they can actually start harboring myofascial tensions from that point. And some are born with these insults. And then others can be created along the way of life, whether it's just how we're moving, slippery floors growing up, not really getting the right traction as a puppy, not building the right confidence in the body. And so the muscles start to harbor tension, and those tension points create insults that can actually continue to hold space in the body until it's released.
So if somebody's dog has a muscle injury, is that what you're saying?
Yeah.
This myotherapy will help them through that.
Yes. We directly, different than just regular massage. All massage is actually really beneficial for animals.
I know.
As well as people, but we do it for our animals before we do it for ourselves.
Yeah.
But it's the trigger point myotherapy aspect of what I do is more specific to the insulted area on the tissues. So my hands or through movement, my eyes will pick up on a hiccup in the gait or a movement pattern that doesn't feel right or look right. And I'll be able to really direct that to the area of the body and be able to kind of find that tension and be able to release it.
And release them ultimately release your fur baby from pain.
Correct.
I love that. Hydrotherapy, let's talk about that because that's what you did with my Great Dane. And he lived to be almost 12.
The idea behind hydrotherapy, whether it be that they're actually swimming, where they're fully buoyant in the water from swimming, or we're using the underwater treadmill. And those two things combined, the water just creates a lift in the body from buoyancy that allows their weight to match their strength. So the bigger the dog, the harder they fall if they're weak. And so what we try to do with the water therapy is meet in the middle, give them an ability to gait with a little lighter weight on their joints, strengthen those joints to that level or strengthen the muscles to the level and be able to support the joints better going forward.
And I think it's highly beneficial for older animals. I know animals with injuries, but my Great Dane was just weak. He was old and he was weak. And so
Right.
doing hydrotherapy, like I said, gave me 3 more years. And then my horse was old as well. You would get in the pool with him. Pretty much. Kind of, as he was swimming. So my dog was submerged and walking on a treadmill while the horse was in a pool.
Right. We did most of the work with the horses, just the swimming and the endurance and building up the cardiovascular aspects of that. So, it's hard to take an animal of the weight and caliber of a horse or a large breed dog and ask them to exercise on sore joints. So then we lose the wind and the endurance aspects of things. So we have to be able to exercise them. So the water relates to being able to increase the exercise, increase blood circulation, building muscle tissue and strength.
Right.
Being able to better support the joints, so we relieve the pain aspects of what they're having.
So I know a lot of dogs. I think hydrotherapy would be great for dogs who are recovering from some sort of surgery on their leg. Would that be it? Or like a knee surgery or a tendon surgery?
Yeah. There's, the aspects of the water therapy is great because it relieves the joints, and so they can heal from an ACL surgery,
Yes.
say. Hip surgeries are another big one. And as well as, neurologic, conditions, so spinal surgeries, being able to allow their legs to move and understand. I like the water therapy to actually understand dogs from a neurologic standpoint, because if neurologically they're not working, they're not going to be, or if there's no connection, they're not going to move their legs in the water.
Right.
And so if a dog goes in the water and starts to feel the ability to move all of their legs, that tells me neurologically they're connected, but too weak to make it happen on land. So then we kind of make that transition and start to go a little further. So we can actually use it. I'm not an ability to diagnose, but we use it to help the veterinarians understand, hey, in the water, they're able to do this, this, and this, and be able to understand that they can now make a better, understanding and a better diagnosis from their perspective going forward for their client.
I love that. Talking to Erica McElway, Change Your Range in Holyoke, Massachusetts, pretty much dedicated your life to rehabilitation for our fur babies. What about laser therapy? You do laser therapy at Change Your Range too.
Yeah, laser therapy, it's really cold laser. Basically an invisible light, so it's light therapy that is penetrates and gives the cells the energy to regenerate and build. And so we can actually increase circulation to areas that are not getting that good circulation. Right. So wound care, depth of penetration for a spinal injury after surgery, or as an option if surgery is maybe not available, right? So not all cases are surgically repaired or can be surgically fixed. Maybe the animal is too weak to undergo surgery, but yet we have to look outside the box to continue to support them. So the laser therapy I really look at as an extension of my fingers. Yeah. So as I do the massage and the topical and things from the external surface to penetrate into the body, maybe there's a pain that I can't really put too much pressure in. So the laser can actually go over that area and penetrate right down the different layers of the cells and the tissues so that it can actually start the healing from the bone out.
So it'll start like regenerating
the tissues and the cells to, and again, healthying them up, giving the circulation in there so that they can heal.
I love that. And you guys also do something called PEMF. What is PEMF?
I know. It's something we hear all the time now. But I do have all this PEMF therapy. I'm like, PEMF therapy?
What is it?
So it's pulse electromagnetic frequency.
Okay.
And so it's a magnet therapy. And it's actually the same energy that is worked with when you have an MRI for imaging.
Okay.
So people can go in for an MRI and come out, and they actually have been able to speak about that experience and say, I feel better. I feel less pain. So the magnetic frequency has been around for a long time as a treatment plan. And now that they've been able to more understand this throughout the years, and again, early in my career, 20 years ago, we were available to have these therapeutic mats that you sit on and lay on. The dogs lay on them. They're blankets that go on the horses. Treats the animal in about 30 minutes by session, so they have to stay on top of this one area for 30 minutes. Mm-hmm. They now have these great machines device that are accessible that will treat the dog in maybe 10, 15 minutes.
Nice.
That's amazing as well. And so that is, again, another type of frequency, works on a magnetic level. All the cells are made up of positive and negative charges. So this is a pulse. It goes positive to negative. So as it rotates, it actually allows the cells to be attracted or repelled. And from that, you can create the shuffle that's needed in order to